The Ministry of Health has today ended their breastfeeding week with a breastfeeding run aimed at advocating for breastfeeding levels. The majority of employers have not considered setting up breastfeeding cutters at workplaces, which has resulted into having malnourished children and other related.
Research has shown that breastfeeding is recognized as the best source of nutrition for infants. According to the World Health Organization, mothers feed their children for 6 months before introducing them to solid foods. However, according to the Ugandan Ministry of Health, only 66% of Uganda get breastfed, leaving the 44% out of them.
Only 66% of the newborn babies are breastfed within the first hour of their life. Only 66, meaning that only 44% are not breastfed. And we continue breastfeeding exclusively for 6 months. This means that at least 34% of the children in Uganda, they miss the perfect blend of the nutrients a child needs to grow. They too miss another major challenge is the poor complementary feeding, which has been mentioned during and after the introduction of other food to the infant. Only 14% of the lactating women provided the minimum frequency of meals and the minimum diet of diversity to their children. In fact, the highest level of malnutrition, child infections and illnesses are reported during the complementary feeding.
In Uganda, mothers have given birth to their children without career guidance from the elders on how to raise and breastfeed their children. However, some of these get tipped on how the process goes, if lucky, from their routine medications and procedures received by mothers during labor can affect the infant behavior at the time of birth, which in turn affects the infant's ability to suckle at the breast.
Most working women are not breastfeeding their children optimally. You immediately start giving the children infant formula. So we encourage women to breastfeed these children even if they are going to work, because it's possible breast milk when they go back to work and continuously exclusive breastfeed for 6 months and continue up to 2 years. So the workplaces is why we are running. The workplaces have to have facility breastfeed optimally.
Following public outcry, most of the fathers claim the mothers do not want to breastfeed in fear of wearing their body shapes out, while others have left their children with babysitters animal milk.
This is just being informed. Let's give opportunity for babies to be raised properly, for babies to get the opportunity to be breastfed, because we know that breast nutrients that you can ever find in all food. So if we give the opportunity, the kid can be raised properly, they can have natural immunity to fight some of even the diseases, and they can even live longer. We're even starting to suspect or imagine an inquiry whether there is an attachment of the more degradation today.
Most infants who are not breastfed experience more episodes of diarrhea, ear infections and lower respiratory tracts, and are at a high risk of sudden infant death syndrome, diabetes and obesity. Breastfeeding also helps protect mothers from breast and ovarian cancer. This has been a feeding run and healthy camp organized by the Ugandan Ministry of Health. Report compiled by Asha Kulsum and Godwin Kayizi for Speak Uganda Record TV.
Kulsum now, Kampala Capital City Authority is deeply concerned about continued violation of the environment. According to the KCCA Executive Director Andrew Chitaka, people who continue to fill the wetlands that pollute the environment with fecal matter should stop.